Well, hello, everybody. It's David Farrell from the Alameda County Public Health Department. Ready for you to thankfully join us this Monday afternoon. Appreciate you hopping on. We'll give folks just a minute to log on here and we'll get started. Thank you. Okay. Good. Well, let's get going. Thanks again for joining. Always willing to try to keep you updated with the ever-changing guidance associated with this pandemic. We expect to keep these Monday afternoon webinars going for you through the month of March. And then we'll probably switch to a once a month format. So let's go ahead and get started. So just wanted to give you a quick update. Currently, Alameda County is supporting 25 of our long-term care facilities. Oops. Sorry about that. Hold on a second. Sorry about that. So this is a very low number for us. We're very pleased with it, but please don't rest. We could have another surge considering all that's going on right now. Here's an update related to the CDC Federal Pharmacy Partnership Program. As you know, this is mostly CVS setting up clinics for you, and they have administered over 51,000 doses to the Alameda County residents and staff of our long-term care facilities. We have almost 12,000 second doses administered to our residents. So this is fantastic news to know that so many residents are fully vaccinated. Every single one of our facilities on the CVS and Walgreens list now has completed their second clinic, and the majority have completed their third clinic. So the CDC Federal Pharmacy Program is almost over, and we're ready to work with you and help you keep the vaccinations going for the residents and staff who are coming in from the hospital, or for your residents and staff who suddenly have decided that they would like to be vaccinated as well. So all the long-term care facility clinics will be complete by April 3rd of 2021. We help things immensely go faster for CVS and Walgreens by also deploying our own local pharmacists to go out and vaccinate in long-term care facilities and low-income senior housing and at psychiatric facilities. We also, of course, directly allocated vaccine to facilities with the capacity to administer their own, and 1,500 long-term care facility doses, 1,500 doses have been administered to long-term care facility staff at our Alameda County pods. I want to encourage you to keep asking that hospitals vaccinate anybody coming to your facility from a skilled nursing facility or a hospital. People should be vaccinated before they arrive. Certainly don't deny the admission if they're not vaccinated. We did hear from our hospitals last week that they are putting systems in place this week to vaccinate elders before discharging to long-term care facilities, but over the last couple weeks, they have not been able to vaccinate discharges as of yet. So we hope that begins very soon, but certainly please ask for people to be vaccinated before discharging. So what are our options to fill in this gap after your third clinic and before your local pharmacy has vaccine dose supply? As I just mentioned, let's have our acute hospital partners administer the vaccine before discharge. We have skilled nursing pharmacy that can help with our skilled nursing facilities, and our other long-term care facilities, including RCFEs, will work with the Alameda County Public Health Department. And we're currently setting up a systematic way for you to request second doses or first doses for unvaccinated residents and staff. So please be on the lookout for an email from me early this week that will give you specific instructions on how to access the vaccine after your third clinic ends. As always, your staff and your residents can come to our vaccination pods. Of course, it might be difficult for some of your residents to get in a car and go to a vaccine pod. However, if they can do it, certainly this would be your best bet for folks to get their second dose or perhaps their first dose. But people shouldn't wait. If they're ready to be vaccinated, we want to make sure that they have access to the vaccine. So again, just for skilled nursing facilities for now, if you're a skilled nursing facility, we have set up skilled nursing pharmacy in Hayward and created an alliance with this fantastic partner who will be serving all of the Alameda County skilled nursing facilities and their vaccine needs after the third clinic is over and before their local pharmacies have vaccine supply. So essentially, we'll be redistributing Pfizer second doses as well as Johnson & Johnson Janssen vaccine to SNP, who will then go and set up clinics at our skilled nursing facilities. And for the other long-term care facilities, including assisted living, RCFEs, board and cares, you'll be working directly with us, and we will mobilize a couple of vaccinators that we will send to your community to take care of residents and staff who need second doses or who are unvaccinated and would like to receive the Johnson & Johnson one-shot Janssen vaccine. Essentially, we would like to use the Johnson & Johnson Janssen vaccine for any unvaccinated residents and staff so that we can stop this cycle of having to always get that second dose. So for unvaccinated individuals, we will be utilizing the Johnson & Johnson one-shot Janssen vaccine. So again, be on the lookout, and I'll send you information on how you can request the vaccine for your residents and staff. The impact of this vaccine has been unbelievable. And the CDC just released another research study touting the benefits of the Pfizer vaccine in long-term care facilities. And here you can see the data. You can see what's happening over the last month and a half, February to the middle of March, compared to during the terrible months that we endured during the pandemic. So we've seen about a 99% drop off in deaths over the last month and a half compared to any month and a half period during the pandemic. So excellent results. And of course, all over the country, we're seeing the same impact at our long-term care facilities. Considering how much these facilities have endured, we're seeing fabulous results as a result of the CDC Federal Pharmacy Partnership and, of course, the efforts of local counties like Alameda County. Just last week, 93% of skilled nursing facilities reported no new cases. This hasn't happened in a very, very long time, since early March of 2020. So let's get into the visitation guidance now. Last Monday, I let you know that this had just come out, and we expect that CDSS will release a provider information notice any moment. And we've heard that CDSS is going to fully align with CDPH AFL 20-22.6. So you can expect that the guidance reflected in these slides you see here will be the same guidance that will come out in the CDSS pin on visitation. So first and foremost, please remember that the only thing that's changed as a result of our high vaccination rates so far is visitation. And all of you, please remain vigilant on screening and testing and quarantining new and readmissions. Their vaccination status does not impact anything that you're doing around screening, testing, cohorting, or quarantining new admissions. None of that guidance has changed. So this is the only guidance that has changed so far. We certainly expect more guidance will change, but that will depend again on the number of individuals getting vaccinated. So here's kind of the breakdown of the new guidance in AFL 20-22.6. It indicates for us that right now, because we're in the red tier, that indoor in-room visitation is certainly allowed, whether people are unvaccinated or just partially vaccinated. And visitors can visit with individual residents if they're in the yellow cohort or yellow status, like a new admission, or the residents in the green status, or the COVID negative residents or COVID recovered residents. Visitors don't have to be tested and they don't have to be vaccinated. So this new guidance reflects a real loosening, if you will, of indoor in-room visitation for your residents and your families. But please remain vigilant around screening and infection control and testing. CMS also loosened their visitation restrictions last week, and their visitation restrictions are actually a little bit more stringent than CDPH. However, CDPH made it very clear last week that long-term care facilities should follow their visitation guidance. And here in Alameda County at the Public Health Department, we met with our clinical policy group, and they also are planning to, and Alameda County is planning to also align with CDPH AFL 20-22.6. So specifically, in the past, Alameda County Public Health Department wanted you to restrict all indoor visitation if you were in the midst of an outbreak and completing response-driven testing. In AFL 20-22.6, CDPH indicates that you can still facilitate indoor visitation even if you're in the midst of an outbreak and completing response-driven testing. And Alameda County aligns with that. In addition, when it comes to indoor in-room visitation, CDPH indicates that you can allow it in both the yellow and green cohorts, and Alameda County will align with that as well. You can see in the middle there where CMS deviates a little bit from CDPH and Alameda County. CDSS, if I were to create a column for them, I would expect that they also will mirror CDPH and Alameda County, so that we'll all be in alignment. In addition, in AFL 20-22.6, it indicates that fully vaccinated residents of fully vaccinated visitors of fully vaccinated residents may have brief, limited physical contact with a resident, a brief hug or holding hands. Of course, both of them should still have their masks on, and they should wash their hands before touching and wash their hands afterwards. But human touch is really important. and this AFL indicates that it can be allowed. If you're wondering how to figure out or how to verify that visitors have been vaccinated, they can either show you their card. Certainly in your list of screening questions at the door, you'll want to ask people now if they've been vaccinated, how many doses, and what was the date of their second dose, so that you can determine if they were fully vaccinated, right? Because fully vaccinated means 2 doses, and the second dose was administered more than 14 days ago. That's the definition of fully vaccinated. Some facilities are having visitors sign an attestation that they've been fully vaccinated and that they were tested within the last week. So you may consider that as well. In addition, in this AFL, communal dining, group activities, and non-essential personnel can resume if we're adhering to the core principles of COVID-19 infection prevention. You should always be trying to accommodate outdoor visitation with safe distances and PPE, considering that is the safest. On a day like this, the less riskiest, of course, is indoor visitation in a large open communal space with good airflow. And still the highest level of risk when it comes to visitation is indoor in-room for residents who might be bedbound. But even in those cases, really the key is, of course, source control, wearing the correct PPE, but also a small in-room air circulation system that you can buy on Amazon. What we're really seeking to do is make sure the airflow gets circulated, that it gets cleansed. And for $300, you can purchase a portable small unit that can be placed in residents' rooms to make sure that the air is being circulated and being cleaned as it is. There are variants in Alameda County now that are very, very infectious, and that necessitates that you continue to work hard to try to convince people who didn't want the vaccine initially to reconsider. Just because your third clinic is over doesn't mean that you should stop having one-on-one conversations with your staff, asking them to reconsider being vaccinated. And now that the Johnson & Johnson one-shot vaccine is available, perhaps that would change some individual residents or staff's mind, and they may reconsider being vaccinated. But without a doubt, the higher your vaccination rates, the safer your community is, and the more likely it can get back to normal. As we've mentioned, here are the core principles of infection prevention that you'll have to continue to adhere to. None of this guidance has changed. As of yet, the only guidance that has changed in conjunction with vaccination rates is visitation. So you can start again, of course, with communal dining and activities. Always best to hold this outdoors if you can, safe distancing. You'll certainly want to limit the number of people at tables, maintain distances, and try to create little pods within a COVID negative residence so that you can easily do some contact tracing if you have a positive case. Here at Alameda County, of course, we're always looking for any breakthrough infections. A breakthrough infection would be someone who tests positive after being fully vaccinated. We're also always looking for any reinfections of individuals who are COVID recovered and then tested positive after 90 days. So our health officer order that we issued on November 24th will be updated. We want you to follow AFL 22.6, and we will change this so it's congruent with that AFL. And again, this will allow you to to keep indoor visitation in place, even if you're in response-driven testing after identifying a positive case. You may have heard about the CDC and their publishing what fully vaccinated people can do in non-healthcare settings. And I just wanted to be clear that the CDC defines assisted living facilities as a healthcare setting. So if any of your residents or staff got wind of this update and felt like things could change at your community, you may need to remind them that no, CDC defines RCFEs as healthcare settings. I'll stop there and see if there's any comments or questions in the chat box. Any comments or questions? Anyone could just come off mute and ask a question. Okay. Good. All right. Well, I have a few more slides to share with you then. I want to talk to you a bit about creating a quality workplace. I know that all of you are rebuilding your businesses, rebuilding your census, and rebuilding your staff. So I want to share with you just evidence-based best practices related to creating a quality workplace as you recover from the pandemic and rebuild your business. So let's talk about 3 very specific evidence-based best practices that work in all long-term care facilities. And the first one is consistent assignment. As a leader, you have a choice of whether you rotate staff assignment from one group of residents to the next, or you consistently assign the same caregivers to the same residents every time they come to work. And basically everyone chooses between those 2 staffing models. And for many, many years, many leaders thought rotating assignment had good advantages because then all the staff could generally know all the residents. Whereby the other train of thought on consistent assignment was, well, if you consistently assign the same staff to the same residents, then they'll deeply know that group of residents. But people really had different opinions. So what does the evidence say? Well, without a doubt, the evidence or the research that is out there supports consistent assignment over rotating staff assignment. And there's up to 15 research studies that support consistent assignment. They speak to the evidence around it enhances relationships, it improves staff attendance, it improves satisfaction, lowers turnover, improves accuracy of assessments and screening, and improves clinical outcomes and quality of life. So consistent assignment of your caregivers to the same residents every time they come to work has a strong evidence base over rotating staff assignment. For many of us, we believe in consistent assignment, but we can't really implement it. And implementation requires scheduling it. And here's an example of how you can schedule consistent assignment. Here's an example of a 4 on, 2 off schedule with an even number of caregiver assignments, where 3 caregivers are serving 2 resident assignments in a memory care unit. And here you see Maria is always assigned to the 10 residents in group 1 every time she comes to work. Jen is always assigned to the 10 residents in group 2. And Ellie always fills in for Jen or always fills in for Maria. So between Maria, Jen, and Ellie, they're consistently assigned to these 2 groups of residents, 20 residents total, and Maria, Jen, and Ellie become the experts on those 20 residents. They know them so well. And how do they know them so well? Because they were scheduled to know them so well. So if you want consistent assignment to work, you got to schedule it and you got to measure it and you got to support the staff who come to you and say certain residents are just so difficult that it's only fair to rotate the assignment. That's not how you fix the challenging resident dilemma, by rotating staff assignment. If people are concerned about their assignment because it's challenging, this is your opportunity to find a solution of how the staff can work better with the residents, not pass the residents on every other week in the form of rotating staff assignment. In addition, consistent assignment works best if housekeepers are consistently assigned, activity staff, social workers. Certainly you have to revisit it periodically and make some changes, and you have to make sure that the staff feel like it's a fair process. There's so many organizations that work with long-term care facilities that preach the benefits of consistent assignment over rotating assignment. Make sure that you're adopting this best practice. And if you need any help with that, please let me know. So once you put consistent assignment in place and the staff really deeply know the residents, then effective huddles can take place. And huddles are simply ways for leaders of assisted living communities to have regular communication with the staff about how things are going on the units and how things are going in the neighborhoods. This is the most important system of communication that any long-term care facility should have and has to have in place if consistent assignment is going to work well. So every day, we hope that you're having a huddle with the day shift staff, a huddle with the evening staff. It's important that everyone really gets on the same page. If there's struggles within the shift, certainly a mid-shift huddle could be an important solution. Huddles are important because they bring people together and get everybody on the same page. Huddles are successful for caregivers if they always start consistently on time, if they're succinct and efficient, and if it allows the caregivers to safely provide relevant information about their residents that the interdisciplinary team will actually listen to so that people can problem solve together. Good huddles have an agenda, and usually the agenda looks like this, where you're covering any new residents that have come in. Usually new residents are most at risk. Any residents who simply are at risk due to their multiple comorbidities. If you've seen any changes in condition, unplanned discharges, pending care transitions from one unit to another, any incidents, accidents, new risks or focus areas, or other key information, news, announcements, kudos. You can cover all of this in 15 to 20 minutes, and a huddle is just necessary for you to do with caregivers every single day. New admissions, like I said, are at high risk, so you always want to be tuning in the caregivers on your new admissions. They're the ones most likely to be readmitted back to the skilled nursing facility or to the hospital. So you want to kind of front load your interventions to keep those people safe and get the staff tuning into the new admissions, at least for the first 2 weeks of their stay. A good huddle usually has a whiteboard so that people can kind of see some important information that the leaders and the staff think is important to go on the whiteboard. Whiteboards provide staff with visual cues that they can then come back to after the huddle to be reminded about an admission or a discharge, or simply just some risk factor that they wanted to be reminded of. Good leaders are good facilitators. And if you want to have a good huddle, you should probably be involved, because you'll have to build the comfort and competence of the caregivers to contribute to that huddle. So make sure that people feel supported and safe to share what they know, compliment people who speak up, set some rules if there's some finger pointing going on, and try to promote some constructive engagement. And then finally, if you have consistent assignment in place and you have regular huddles in place, then what really pays off is when you invite the caregivers to actually be involved in the care planning for your residents. The huddles essentially help them be key contributors in your care plan meetings. And caregivers can provide incredible information in the form of those care plans. So please make sure to try to invite your caregivers to any type of care planning meeting with residents and families and your nurse leaders so that you can hear directly from them about whether they think the plans being put in place will actually work. When you involve caregivers in care planning, they have a very clear idea of what's expected of them. And they're much more likely to carry out the care plan if they had a say in how it was shaped. So finally, to create a quality workplace as you rebuild your business and hire new staff, now is the time to put new systems in place, making sure that your staff and caregivers are consistently assigned, making sure that you have a venue for them to share what they know about the residents, and then an opportunity to shape care plans that they'll be expected to carry out. So to create a quality workplace, you need a staffing model like consistent assignment that supports staff's ability to know the residents really well. Then you give them venues like huddles so that they can safely talk together and share what they know about the residents. You structure that venue with agendas so that they talk about the right issues related to the residents. You provide the psychological safety for the caregivers so that they feel comfortable sharing what they know without fear. And then provide the leadership that facilitates and models respectful problem solving and collaboration, and have some organizational humility where you understand that what the caregiver's perspective is their reality. So show that you care, listen, and respond timely. On Wednesday, CDSS is having another informational call, so be sure to tune in. And this was released via, I think, a pin. But here's everything that you need to know about the CDSS informational call coming up this Wednesday. So be sure to tune in. And here's where I pause to see if Nicole or anyone from the Ombudsman Services would like to make any announcements or. Okay, no. All right, great. Any questions? Would anyone like to come off mic and ask a question, or come off mute and ask a question, I should say? And let's see if there's anything in the Q&A. Should dining be 25%? You know, Enrique, dining at 25% is related to you know, restaurants in the community. It's not necessarily applicable to RCFEs. However, you could consider using that standard in your own dining room. It would make sense. But for the most part, what they're saying is make sure that residents are spread out, make sure that people are wearing masks when they're not eating or drinking, but I haven't seen anything about 25% capacity. Next question, will the Johnson & Johnson Jensen be available for third clinics at long-term care facilities? No, if CVS is holding your third clinic, they're going to be bringing the Pfizer vaccine to that third clinic. However, if people want to get the first dose at their third clinic, they should definitely get the first dose at the third clinic. And Alameda County will arrange somehow to get your residents and staff the second dose of Pfizer when it's needed. Do we know how long the vaccine will last? Is it a year or less? No, we don't know because, we're just starting to use it. I'm sure eventually we'll know how long it will last, but at this time, no, we do not know. Any other questions? Okay, hearing none. So again, I'm your resource related to your vaccine needs after your third clinic ends. So don't hesitate to reach out to me. We're figuring out how to serve you during this, gap between the third clinic and when your pharmacy will have vaccine supply. Please be checking with your contracted pharmacy. Keep asking them when they think they'll get supply, because eventually they will serve your needs for the vaccine. But in the meantime, we're here to help you, and we're putting systems in place to do just that. Okay, with that, I think we can sign off, and I wanted to thank you all for tuning in. I hope you have a good rest of your day, and appreciate all your efforts in keeping your residents and staff safe. Thank you all.